Assalamu alaikum. Today's presentation is about prostatitis. What is prostatitis? It is the inflammation of the prostate gland, seminal vesicles, and the posterior urethra. This prostatitis is of two types, acute and chronic. Acute is defined as the prostatitis which is of short duration, whereas chronic is that type which is of longer duration, which is the complication or the result of improper treatment of acute prostatitis. Acute prostatitis etiology. The etiology is bacterial mostly. Bacteria may be E. coli, Staph aureus, Staph albus, Staph faecalis, Neisseria gonorrhoeae, chlamydia, etc. And the route of infection is direct from the neighboring structures or the local structures, and hematogenous. Hematogenous means through the blood from distant organs. That may be nearby organs or it may be distant organs. And thirdly, it may be secondary to acute urinary infection. Clinical features: general, fever with rigors, generalized body aches and pains, backache, pain on micturition, threads in voided urine, perineal heaviness, rectal pain, irritation, frequency of micturition. On per-rectal examination, we find that the prostate gland is tender and the seminal vesicles are tender, and one lobe of the prostate gland is swollen more than the other. Treatment: prolonged treatment with antibiotics, trimethoprim and ciprofloxacin. Prostatic abscess. It is the complication of acute prostatitis. It may present with fever, with rigors, rectal pain. Per rectal examination shows prostate enlarged, hot, tender, with retention of urine. Treatment: for retention of urine, we may do suprapubic catheterization or the suprapubic puncture, so that the retention is relieved. And for the abscess, we do the incision and drainage by periurethral resection. Anti-inflammatory drugs, antibiotics. Chronic prostatitis. In chronic prostatitis, what is chronic prostatitis? Is of long duration. As I said before, it is improperly treated acute prostatitis. That infection may be secondary to chlamydia or E. coli. These are the bacteria which are very resistant to treatment. They take long time for proper treatment. Clinical features: intermittent fever with rigors, posterior urethritis, prostatic pain. Diagnosis is 3-glass urine test. We ask the patient to take the first morning specimen, avoid it, then take the second morning specimen and take that urine in 3 glasses. We find that the first glass has the most threads, then the second glass has the lesser threads, and the third glass are even lesser threads. So these threads are the inflammatory structures or pus-like structures which are taken for examination. On per-rectal examination, we find that the prostate gland is boggy, tender, and the upper lobe, upper end of the prostate gland is not reached. It is inflamed, tender. Prostatic massage shows there is pus and bacteria on the palpating finger. Urethroscopy, we do it with the help of a fiber optic instrument passing through the prostate, through the urethra, and we see that there is inflammation of the prostatic urethra and pus in the prostatic ducts. Treatment: broad spectrum antibiotics, example trimethoprim, flagyl, doxycycline. All these are given for 7 days. Unani treatment includes you see, thank you, Kulmandin. Unani treatment is the Kulmandin that is given twice daily. The reference is from the Pale and Love, Short Practice of Surgery by Pale and Love. Thank you.